But when I was a resident, I used to panic. I had a lot of stage fright. The number of times I have not won is more than the number of times I have won. So what I have learned, I always try to compare myself with the person who have won. Okay. So the points I found, which later on after I rectified, I started winning. I can discuss a few about that. There are a few tricks I also copied from you also, how to present at a place, like looking at the audience and stuff like that, which you can discuss later on. But the main thing was something catchy and something unique and something which creates an adrenaline rush among the people who are seeing the poster. So whether be it undergraduate or whether be it postgraduate, read those points in Dhingra thoroughly after you have finished the reading the book. Because in postgraduate residency, one must finish an undergraduate ENT textbook by first 6 months.
We identified the foramen correctly, we identified the structure correctly, but we forgot to mention the side of it, right or left.
Yeah, that's what. After doing these mistakes only now we know that what perfect answer should be. So that's what I tell my juniors also. You should participate. If you don't participate, you won't make mistakes.
Hello viewers, in a recent video, I had talked about the requirements that postgraduate medical students need to fulfill to be eligible to appear in the university exam towards the end of their postgraduate tenure to become specialists from a university in India. These requirements that I had talked about are across all post-graduation subjects, so it's not about a particular subject like medicine or general surgery like that. It's for every postgraduate medical student. And I had listed out many different requirements. One such requirement will be discussed in detail in today's video. This is the requirement related to reading of a paper or presenting a poster in a state conference, a zonal conference, or a national conference. Now, while this has become a mandatory criteria introduced by the National Medical Commission, when I was a postgraduate trainee, this was more of a task that we wanted to perform because it really did enrich our post-graduation experience. Now, if you are a postgraduate trainee, you should definitely not only seek to participate in these events, but also seek to participate in these events to win. Some of these events are competitive and have very attractive PG award prizes. But even if you don't win, you should have the inclination to win and the enthusiasm for it. Speaking of enthusiasm, I would like to welcome to this show today Dr. Mainak Maitra, one of the most renowned ENT specialists in India, and he has inarguably the most enthusiasm for academics as well as in participating in academic conferences across India. Recently, he participated in the West Bengal State Conference of the Association of Otolaryngologists of India, and in this video, he will graciously share with us his experience, and I hope this will motivate and inspire as well as help many postgraduate medical students regarding how they should approach participating in the state conferences or zonal conferences or even national conferences. I would even extend it beyond to international conferences. It is definitely an experience that you should have, and it is an experience that will benefit you throughout your professional career. So without further ado, let's welcome to this YouTube channel Dr. Mainak Maitra for the second time. Previously, he had joined us to share his exemplary knowledge about cochlear implant surgery. I would highly recommend you check out that video because I believe it is perhaps one of the best videos about cochlear implant that you will find on YouTube. So let's welcome Dr. Mainak Maitra to this YouTube channel for the second time today. I would like to congratulate Dr. Maitra for his gold medal victory in the recently concluded state conference. And the first question I have for you is, what really motivates you even years after completing post-graduation to still participate and still compete in academic conferences?
So basically, the thing is that conferences are the only place where we find time for academics. In our day-to-day practical life, where we are always busy with the OPD patients as well as the private patients that we are seeing, in order to upgrade and update one's knowledge and skills and what other people are doing, the kind of work, what they are witnessing and what we are doing, and also to showcase what we are doing and also to know what other people are exercising, the new surgeries or the new methods which we might not be aware of. So I feel that's what motivates me to take part in these conferences, and I always enjoy taking part in any kind of events or competitions so that we can understand where one stands in the current scenario.
So the questions I have with me, these are all prepared by subscribers and people who are very enthusiastic about these things, especially postgraduate students. So they would really
Okay.
benefit from knowing about your experience in the recently concluded state conference. So briefly, if you could tell me which events you participated in and the nature of those events.
Yeah, basically, in the state conference of West Bengal AIWB Con this year, which was held in Holdia, so there were, for my category, whatever I was eligible in, I participated. I gave my name in it. So what included was a junior consultant paper award, the e-poster award, which was I was eligible in, and the video presentation award. Okay. I was also eligible in the quiz, but my partner was a bit sick, so she could not attend the conference, so I did not participate in the quiz. So that's what I took part in.
Okay, so all for the benefit of the viewers, these are events where in most of which you have already won. You have already won the first prize in the quiz competition. You won the second prize in the junior consultant award, and this year you won the first prize in the poster award. So that's a
Yeah.
stellar record. If you could briefly tell us about each of these events, the poster event and the other
Yeah.
events.
So, in case of the Junior Consultant Paper Award, the eligibility is one must have a degree of MSc or DNB or DLO, whatever it is. And as far as I recall, the age should be less than 40 years. Okay. So this was the eligibility criteria. And so I had presented a paper regarding clinical radiological differentiation between sinonasal non-Hodgkin's lymphoma and sinonasal squamous cell carcinoma. This was my paper, which I had presented there. And regarding the poster, I had presented uh, some few case series of torrential bleeding which we came across at our institution in the field of ENT and how we managed it and like that. And in the video presentation, which was it was a 8 minute, as far as I recall, 8 minute video, which we had to present. It could be anything, but I presented a newer conservative technique of pituitary surgery, which our institution is following, called the transnasal transsphenoidal endoscopic minimally invasive pituitary surgery, MIPS. In short, we call it as TNTS MIPS. So that's what I tried to describe through my video of the surgical part.
And one of the great lines that you have used in, I believe, your poster is the domain of surgery for the ENT surgeons. And please repeat that one liner from.
Yeah, the what I always prefer is we ENT surgeons usually don't believe in ourselves. That's why we are not that confident when we are facing other specialties. But it's not true. We are also dealing in a very vast range. Basically, we are dealing from the dura to the pleura. So if we can dura from the skull base and to the pleura, that means almost just above the thorax. So that's a big area. And one of the most difficult and most critical and anatomical concept is that within a short space we have a large number of important neurovascular structures as well as the airway within that. So we should have proper anatomical knowledge as well as surgical skill to deal with the anatomy as well as the surgical and pathological aspects of the diseases involving this area. So that's what I say when I'm always telling my juniors that we, the ENT surgeons, are also dealing in the long area from the dura to the pleura. So that's the main area of interest for us.
Yes. If there is one thing people should take away from this video is the domain of ENT surgeons is from dura to pleura. Very catchy line. So you participate in so many different events in this state conference. I think people would like to know how much time did you devote to preparing yourself for these events and how did you find the time despite your busy work schedule?
See, frankly speaking, I always plan 1 year ahead that what topics or what things I'll be working upon. So the paper which I presented this year, I had planned 1 year back when I won. Last year, I won the second prize in this junior consultant category. So this year, I felt that I should present something unique, which was this paper was tactfully thought by me. I mean, I was really because I'm telling giving a short background story behind the making of this paper about the clinical radiological diagnosis or differentiation between the two variations of malignancies that we come across. So, since from our medical school days, we know that first is clinical examination, then comes investigation, and from that we should go for the diagnosis or provisional diagnosis. But in when we are dealing with malignancies, histopathological diagnosis is something which is the real what matters, really what matters, and that all we can do is take a biopsy and wait for the reports to come, right? So when we are dealing with two malignancies of the sinonasal tract, like I talked about the squamous cell carcinoma and the sinonasal non-Hodgkin's lymphoma, squamous cell carcinoma is the most common sinonasal malignancy, whereas non-Hodgkin's lymphoma is the most common non-epithelium sinonasal malignancy. The main purpose is that of this study was because the modalities of treatment for these two diseases are separate. For squamous cell carcinoma, it is a surgical intervention followed by radiation or chemotherapy, whatever is done. Whereas in case of non-Hodgkin's lymphoma, the mainstay of treatment is chemoradiotherapy in any combination. So, since our disease patient burden is so high, so I thought of something so that even before we can get the biopsy report, if we can predict what that biopsy can come out as, so that will be helpful both for us as well as the patients in the workup of the patient. So this was the basis which provoked me to think about some studies like this, and thankfully I got a number of research articles in the uh, literature also, which have done a lot of studies on these. Especially these papers are from Japan and Southeast Asian countries, where these sinonasal malignancies are quite high.
So the key thing is to plan a year ahead. So for each of the events, you planned a year ahead.
No, for the poster, I planned because poster, I feel I just want to say that poster should be something which is catchy. It should be something unique that separates you from rest. You have also won the poster award, so we obviously know that we all know you are the beginning and you motivated me as well, being your junior, to go for the award. Yes, though you won it in residency days, but I won it afterwards. But still, that's your paper, as far as I recall, was the uh, tubercle of Zuckerkandl, the Northern Star for a thyroid surgeon, if I'm not wrong.
Correct.
So from that, and I have always been a follower of what and the way you present it, because you are a great presenter as well as an orator. So whoever is listening should know this, that this person in frame is also a great orator. So there are
Right
few
now,
tricks
you
I
are in the
copied
frame.
from you also. There are few tricks I also copied from you also, how to present at a place, like looking at the audience and stuff like that, which you can discuss later on. But the main thing was something catchy and something unique and something which creates an adrenaline rush among the people who are seeing the poster, because majority of posters are like studies and like, so I thought of something. Then because our institution is a tertiary apex hospital, we have a multidisciplinary team and a lot of efficient interventional radiologist guys who can do wonders. The basically the three patients we had, more than us, it was their credit in saving those all the three patients. So that's what I would say made me think do the poster on the topic. And the name was, I thought of a name which was a bit catchy. It was something which will not reveal the entire thing, but also which will inculcate some doubts or interest in the mind of the judge or whoever is seeing the poster regarding what is it. because even before I presented, many people saw my title of my poster and said, "What are you presenting?" Okay, so the title of my poster was from silent threat to bloody reality, an ENT perspective, an ENT experience, kind of like that.
Hmm.
So that's all. That's the way I think we all should think
And
about it.
about the video event?
Yeah, video event is something. Look, many people present videos, and I would like to mention a few points. Ideally, for every junior resident or whoever is participating in any competition, they should thoroughly go through the criteria mentioned in the uh, what to say brochure, because many people don't read through that and they're automatically disqualified. Like in the video presentation, it was clearly mentioned that the video should be in MPEG, MP4, and some specific video formats. There is no PPT format. So many people had presented the video inserting in a PPT, PowerPoint. So that is already disqualified. Even the judges got angry on that. Okay. And I am not a good video editor. The person who was a faculty of Command Hospital who won it, her video, she was a truly the winner. Her video was like a story, a movie of 8 minutes, which was being shown. So before I participated, I thought I had the best video, but again, after participating, I landed on the ground. I was flying high. I landed on the ground, but I still feel the video I presented was good. I felt happy about it. It's not always about winning. You should be satisfied that what you are presenting, because we are doing pituitary surgeries in a new technique, much less conservative way. And so even the judges, after the results were announced, said that you guys are doing a great job with the type of surgery you are doing. So we are in the line of, we have already have a publication regarding that method. We had a huge publication and a huge team who had published the data along with of minimally invasive pituitary surgery along with image guided assistance. But we are also planning to go for a controlled study. I mean, comparative study between conventional pituitary approaches and the minimally invasive approaches that we do. So let's see. We are still collecting data on that and working on it.
Right. So the National Medical Commission has made it mandatory now for postgraduate students to read a paper in a national, zonal, or state conference, or to present a poster in a national, zonal, or state conference. This is now mandatory criteria. I don't
Yes,
believe it was
yes.
mandatory when we were residents,
No,
but
it was not mandatory. We always participated out of sheer interest.
yes.
We
So,
always,
but now that it is mandatory,
and
people
moreover, as
have.
a gateway to get to that conference.
Yes, it was mandatory for us to compete in the
Yeah.
events in order to attend the events. So now that it is mandatory, I would, and I still encounter people who consider that participating in these events or winning in these events is practically impossible. So, what advice would you have, having won so many events? What advice would you have for the postgraduate students who think it is a big ask to participate? It's very daunting, it's very scary to participate, and how to, what is an effective strategy to try
I
to.
would say is, yeah. See, the preparation of these events, your preparation should be complete. I have participated many times and have not won. I have not won. The number of times I have not won is more than the number of times I have won. So, what I have learned, I always try to compare myself with the person who have won. Okay. So, the points I found, which later on, after I rectified, I started winning. I can discuss a few about that. Like number one, I would say in the paper presentation, time limit is very, very important, and the way you are making the presentation. Nothing to write too much in the slides. You have to speak. You have to speak and speak in such a manner that the audience ears are glued to your speech. Okay. Next, what I found is methodology of the study. I mean, I don't know the actual marks division of the paper presentation, but if the methodology is properly explained, introduction, no one needs to go because we all are ENT surgeons who are judging are also ENT surgeons. Suppose one is presenting a paper on adenoids. You don't need to say what is an adenoid, what are the features of adenoid hypertrophy, nothing. What one should focus is methodology. Okay. So in methodology regarding what is the type of study, what is the statistical analysis, the inclusion criteria, the exclusion criteria, you have to be very meticulous about it. If there is a flaw in the methodology of the study, I have seen a number of papers, and in my residency also I have done myself multiple mistakes in the methodology itself. So the moment the methodology is at fault, the not only the score, the competition, that's okay, but the study is at fault at that per se. So if your methodology must be very strong and the statistical analysis part, what tests are you using, that should be fluent. I am not that good in statistics, but when I take the help of statistician and seniors who are good in statistical part, but I should be knowing why this test has been used and what it helps in. Okay, so this methodology was an important part. Number two, I would say spelling mistakes. This is very, very important. Casual, silly spelling mistakes, you have missed a letter, you have missed an alphabet. These, the moment your slide is shown on the big screen, those things first come to the view of the judges. That should not happen. You should check your slides regularly. Okay. The next is obviously the way you speak. Many people speak in a different ways. Rule number one, don't read out the slides, which majority of people does. Reading out the slides is not acceptable. I would still say most people does that. Whether be it PGTs, whether be it junior resident or whether consultant or whether be it senior consultants. But prepare your speech for the slide, practice it with the timer, stand in front of a mirror, say it twice, thrice. Now, because I have presented so many times, twice or two times or three times, it's done. The fourth time I present on the stage directly. But when I was a resident, I used to panic. I had a lot of stage fright, which I have gotten over hopefully now. But time dependent speaking is important because you have to know by which time you will reach which slide, because only then you can finish. Suppose the presentation is of 8 minutes, one should target 7 minutes 30 seconds in your practice, because when we are presenting we will be a bit nervous, there will be problem in the laptop, the slides won't go. This. Number 3, I would say videos in the slides. These are technical things which carry a lot of impression. If one is providing a video and suddenly you are not being able to play that video or explain that video in a proper way, or audio, whatever it is, those carry good marks, but if you cannot present it properly, that can create problem. That will because so for that, what one should do is, when you are submitting the slides, we submit it the previous day or on the day of our presentation, always check with the laptop they will provide that your videos are running, and keep that video file in a folder as well as the presentation so that that entire thing can be copied. Most people, because this year I saw someone had created a link in the so-called PowerPoint presentation which he or she had done, and he or she has copied only that file. So whenever she is clicking the link, that link is not working, and this happened in the middle of a presentation. So that is not at all acceptable. That won't help you anywhere, and that also affects the flow of the presentation, right? So that is thing. But out of all these things, I feel the methodology. If the methodology is described correctly, that the audience can imagine, I mean, the judges can see the flow of the events that have occurred in the study, I feel that will create a good impression in the long run.
Yes, so that I think will benefit a lot of people. And what do you have to say about people who say that winning is not possible, it is too competitive? What do you have to say to those people?
First of all, don't expect to win. I know we all always all want to win, but what I would say is never up the expectation of winning. Because the moment you have expectation of winning, you will panic and you will have that pressure on you that I have to perform so that I have to win. Because in my residency, I did that mistake. Now, after passing post graduation, I gave up the concept of winning. Let's see. The only thing which I focused on was my presentation. Let my presentation be up to the mark, because winning, we all know, depends on multiple factors. Not all we can discuss and disclose out here, right? So we all know. Yeah. So forget that. But this is a fact. Yes, this is a fact. I'm telling you. So even wherever, whichever conferences you go in, all India or national or state or wherever, regional, whatever it is, or city, whatever it is. Let's not talk about that. So what we must do is that my performance is such that I am satisfied with what I have told, and your polished presentation should be absolutely polished. That means simple things create good or bad impressions. Like in the presentation, the headings, the writings, the fonts should be uniform. I mean the style of the fonts. If you are using Times New Roman, use all the thing as Times New Roman. These are small things which I have observed that these carry marks. If we are the heading, suppose we are giving the heading of introduction, say we have two slides of introduction. One introduction heading is here, another slide introduction heading is a bit lower. So that visually it's not good. So you should plan in a way that the visual presentation is very fine. Okay, and again I am telling that one should present by looking at the audience. Okay, you should know what you are presenting. You should learn, or after some point of time we don't need to learn, we know what we are presenting, just things. And another important which I missed last year is that when we are presenting the data, like results and analysis, when we are presenting, so at that time the key findings should be highlighted. Either you give it a circle or whatever it is, and so that out of the bar diagrams, pie chart, tables, whatever it is, the significant, you can't read out the entire table per se. The significant ones should be highlighted so that the viewers can focus on that part. So this is what I've learned after participating and failing in number of attempts in various conferences. But that's the thing. I mean, you should not try. I mean, you should always try for winning. You should not think that I will win, I will never win. Forget that. It can happen that you will never win. But that does not matter.
That is very well said. Also, I would like to take this opportunity to say that one of my students won the paper award this year, which is, for me, it is a huge thing.
Yeah.
And so, last question for you. You joined us despite you having such a busy schedule. I believe you have your own YouTube channel.
Yeah, I have my own YouTube channel, but for a long time I'm not getting the time to make one video. That's the
So,
problem. I make try to make videos on ENT awareness topics, like I try to do, and most of my videos are in Bengali, so that the commonest people in my neighborhood or wherever I am practicing get to understand. But yes, let's see what next topic I can think of.
yes, I definitely would want you to join us more frequently on this channel. And I would definitely urge everyone who is checking out this video or who has checked out any of my videos to check out Dr. Moitro's YouTube channel. It's one of the best YouTube channels I have seen. And again, it's about the quality of the videos more than anything else. And he really explains things in a very simple manner. I think mostly it is focused towards the common people, not for ENT
Yes.
specialists.
Yes, it's not an academic based channel. It's mainly for addressing the common masses,
Yeah, that
because they
is.
won't understand the technical terms. I tried to make it as palatable as possible and easy for them so that it is easily understood.
Yes. So the link for that channel will be in the description of this video. And any last words? Any words for the postgraduate students who must be watching this video?
Yeah, for the postgraduates, I would definitely say don't feel bad if you don't win. The main thing is participating. You should participate in every event that you can possibly participate in, because you will be able to see what others are doing. You will be gaining new knowledge. You will be, someone might come and say, I liked you this part of the presentation. And especially the quiz, I must say you should always participate in quiz, whatever, wherever you are. You might not be clearing the prelims, but don't worry about that. If you don't clear the prelims, stay in the audience in the finals also, because these creates what I would say question banks for not only in the quizzes but also in the Viva MS exams which you'll be facing. Sometimes the examiner might ask you something tricky because you are answering well. So at that time, these things which you will hear, and you will go on seeing interesting stuffs and like that, that will hit you in the exam and you will recall and then be able to answer these questions. So like this, your knowledge will also increase about the subjects. Like a small thing, if just a small advice I would say for the residents who are uh, willing to participate in the quizzes, read the bullet points in Dhingra, which is there at the back of the book. There are 150 to 200 bullet points, if I'm not wrong. I forgot the exact name of the chapter, but whatever it is, read those points thoroughly. Each one is a potential quiz question, and also a potential MCQ question, and also a potential Viva question. So, whether be it undergraduate or whether be it postgraduate, read those points in Dhingra thoroughly after you have finished the reading the book. Because in postgraduate residency, one must finish an undergraduate ENT textbook by first 6 months. I had finished it. It's not impossible. I had finished it, and after 6 months, after you finish Dhingra, then you, or any undergraduate, I'm not promoting any particular textbook, but that's the book I'm telling because I have read that. After that, you will need to study the big books, and by big books I mean Scott Brown, then Kennedy, then whatever books you are reading. Okay. So yeah, like that. So no point in fearing that what if I don't win. Believe that you won't win. You participate thinking that you will present in the best way possible to you. You will, you might not win, fine, because I told winning is a chance factor. But still, you have to give your best in the way which you think you can, and then leave winning or losing up to the rest. That's all I have to say.
So thank you once again. Dr. Mainak is someone I know personally. I've had the great honor of working with him in the same
And
institution.
we had also been a runners up at a national quiz at
Yes,
the AOICon 2019, right?
yes.
2018 or 19, Hyderabad.
19. It
Yes.
was in Hyderabad. Yes. So I was about to
Yeah.
go there. Yes, we participated in a quiz, and we participated in two quiz contests. In one, we were eliminated
Yeah.
in the prelims narrowly, and the second one, we were
And I
second.
still remember why we got eliminated. Remember your mistakes also.
Yes,
Because
yes,
we had not answered the
yes,
hypoglossal nerve palsy
yes.
on which side it was.
It was yes. That was the question. I believe it was something with a foramen. It was a
And also
radiological.
for
Yes, there was a foramen question. I think it was a radiological picture or an anatomical picture. I forget that, but it was which structure passes through this foramen, which should have been like the side of the nerve should have been mentioned. That we did not mention. We identified the foramen correctly, we identified the structure correctly, but we forgot to mention the side of it, right or left.
yeah, that's what. After doing these mistakes only now we know that what
Yes,
perfect answer should be. So that's
yes.
what I tell my juniors also. You should participate. If you don't participate, you won't make mistakes. So then, unless you participate, you don't know where you stand. Basically,
So, thank you so much for joining us,
it's been a
and
pleasure.
we will definitely look forward to you joining us on this channel again. And please do
Thank you.
check out Dr. Maitra's YouTube channel. And thank you once again, Dr. Mainak.
Thank you.